So, hello everyone. Today I have with me Dr. Melinda and Dr. Lindsay. I'm sorry.
That's
She's
okay.
an urgent care physician. So, Dr. Lindsay.
Thank you. Thank you for having me.
All right. So, I have a couple of questions for you today that our medical club has gathered. So, first question is, how did you come about to wanting to be a physician?
Well, I sort of went the long way around, so I don't know if that will help anyone or not. But I actually was a nurse first. So I was actually a nursing assistant. Then I went to LPN school. Then I went to RN school. I got my bachelor's. Then I got my master's in nurse practitioner together. So um, I've thought about that since because I did go the long way around, and I do recall having the urge to be a physician even in high school, but I really didn't think I was smart enough. I thought, that's for other people. It's not for me. And so my sister was a nurse, so I just, went that route. But after I was a nurse practitioner for 3 years, I had some really strong physicians that I worked with, and they encouraged me to go further. And then I went on to medical school, and so the rest is history. So I was a little bit older whenever I went back. So.
And how did you know that urgent care was where you wanted to be? Like, did you have a couple of trial and errors here and there?
Yeah, I was a nurse practitioner. I was actually a family nurse practitioner, and I had worked in the ER as a nurse and also as a nurse practitioner. So I sort of knew that I wanted emergency or urgent care from the get go. So in knowing that, really, whenever I went into medical school, I was looking at emergency versus family practice, so I could do urgent care. And truly, just with some different events that happened, I ended up going with family practice. I had a daughter, and she was going into high school, and so wanting things in life to be more comfortable at that time in my life, I was able to pre-match. And once you get into matching and all that stuff with residency, then there's a lot of things that go into that. And having a family, I didn't want to be moving all over the country. So I was able to pre-match in family practice. And so that's settled well with me to be able to do urgent care. So that's the way I went about it. And then, the reason I mainly always liked emergency or urgent care is because I get bored real easy. So I didn't know if I'd really be able to do, just all GI, although that was my main issue with residency, is because I liked everything. I mean, I liked psych, I liked OB, I liked all of it. I like workers' comp. But so with urgent care, you get to see a little bit of everything, and you never really know what's coming in. So you don't get bored, that's for certain.
Yeah, and would you say that perhaps like the variety of cases that you see are also one of like the most attracting thing about urgent care? Because like a couple of students like in our club itself are like they can't keep doing the same thing over and over again. They like the various cases. So would you think that's something that is like really important?
Absolutely. I mean, and truly just you know being able to think quickly and being able to gather information quickly and then give out an opinion. That's another thing, and even these are people that we don't have relationships with versus, like with family practice, with internal medicine, with peds, you're seeing the same people, every year, whatever. So you actually, you form a relationship. And although, you do see the same people over and over in urgent care, but it's not, you're not the only one that's getting everything together for them. We see people really at their worst, people that come to us, they don't feel good because we don't see the well people. We see, there's something wrong. That's the reason you're coming here. So it's a whole different mindset than from other specialty a medical specialties. So.
Absolutely. I as a volunteer as well, I see so many different patients coming in. It's very satisfying. So what do you
Sure.
think is the most satisfying part of your job?
Well, I like procedures. So, and that's why a lot of even family practice internal medicine docs, they will go ahead and even moonlight some in urgent care because, you like doing things, you like doing the setting the fractures, you like, putting on the splints and doing lacerations and, all of those things.
Absolutely. And I think the last question that I have is what would your advice be to those who are looking to go into urgent care?
Well, I thought about that a little bit. Really, whether it be urgent care or any type of medicine, in any field, really. I mean, you really want to find something that you really like doing, that you really enjoy. And I've been very blessed in that I really do like what I'm doing. So it's not a job to me. I mean, we work, one thing a little bit different about urgent care is we work usually 12-hour shifts. We do work weekends, we work nights. Most 12 hours is 7 to 7 or 8 to 8, depending on where you work. There are some urgent cares that do 24 hours, they're open 24 hours as well, like an emergency room. But for the most part, I think just enjoying what you do. I mean, and that's the benefit, to just really during medical school, during your rotations, during residency, really seek out different avenues of what you may want to do and really put some thought into it because once you decide on the residency or the the path you're going to go, that's the good thing about family medicine because you still can you can work in urgent care as family practice. Some rural ERs you can work in as well. You can do occupational medicine. So there's different avenues versus just going to that one specialty. Where you're sort of limited in the scope of medicine that you can practice. With family practice, you can also do OBGYN. And, all of those things that I mentioned is all things we see in urgent care, on a daily basis. So I think mainly if you just find something that you enjoy doing, then it's not really a job, and then it really is something that, because it's your life that you're doing every day. And, if you're working 40 hours a week or 60 hours a week, you truly, sometimes I feel like I spend more time with my coworkers than I do my family. And if I really didn't enjoy it, and just talking to people, and people's not always the nicest when they come in. A lot of them, are nice, even though they don't feel well. But you've got to be able to try to still lift their spirits and be able to, make your day productive and fun, in spite of, everybody else is not always feeling the best. So.
Absolutely. Thank you so much for that advice. I'm sure like a lot of us who are like still looking into what we want to go into the medical field are like
Sure.
considering all those like work hours and stuff like that and teamwork.
Sure.
So thank you so much for all of that advice.
Absolutely. Absolutely.
All right, guys. So this was Dr. Lindsey with us. And if you guys have any questions, feel free to let me know, and I will direct any questions to her. But thank you so much, Dr. Lindsey, for your time today.
Oh, you're very welcome. Listen, I looked at your channel. It looks wonderful.
Oh,
Congrats to you. You're doing a great job with that.
thank you
So
so much.
I hope to be working with you in the future.
Thank you. I hope
You're
to be
very welcome.
I hope to be learning from you more as well. So thank you.
Absolutely.
Thank you.
Enjoy your day. Take
You
care.
too.
All right. Bye-bye.